let's say you have a patient with eczema located on 3 fingers on hand. So only 3 fingers are affected, right? Now, if you remember this remedy to be the specific for this, for eczema on hands, you will tend to give it. But keep in mind the important rules. You have to be very sure that no polychrest is indicated, which means you have to be very sure there are no symptoms in other areas indicating another big remedy. It's important. So don't focus on eczema on hands, because there are many remedies having eczema on hands, but for this remedy, it's a keynote. But let me continue with this example. Well, you have a woman, 35 years old, and this woman has 3 fingers affected by eczema. So there are vesicles between the fingers with very strong itching. And she comes to you and you ask her what the main complaint is, and she will show you these 3 fingers telling you, this is my main problem, right? And you ask her about everything, about sleeping, about everything. And she will tell you, I'm completely healthy, but this is my problem. This is something which make me very, very exhausted. I don't, how to say, she cannot tell it by these words exactly, but you will see she's quite concerned by having this eczema on such a small place. The suffering she will express will be not directly proportional to the degree of eczema you will see. Now, in this case, you cannot think of anagalis, because even though she doesn't tell you explicitly, I'm anxious about my eczema, you will see a woman who is very despair regarding eczema, which is so small. Because there are a lot of people having eczema much more without any psychological influence upon them. But as a homeopath, you have to read between the lines. So if you see a person coming to you with a great urgency, I have eczema here on my 2 or 3 fingers, and I need to stop it. I want to be it gone. She will not tell you I'm suffering, but you will see she will give you a lot of questions like, have you ever seen a patient like mine? Have you ever seen the eczema like this? It's curable condition. Have you ever seen a case finally cured by homeopathy with this kind of eczema? And now you have 2 choices. You can follow what she's focused on, which means you can follow the skin. You will focus on skin, on her fingers. And you will study the blisters and the itching and modalities and local symptoms and everything. And finally, you come up with anagalis. You give it, but it doesn't help. In this case, it cannot help. What you have to do is to get the information from other areas. And the other information is the information which is not given to you directly by the patient, but it's information you have to observe. And you see the woman who constantly asking you about whether it's curable or whether it's not curable, whether you have ever seen such terrible eczema, right? And you see she's very despair, she's very anxious about this small condition. Now, your homeopathic mind should operate in this or with this information in the way you combine these 2 pieces of information in your mind. And you ask yourself, well, I have a patient with eczema. I have despair patient with eczema, or I have a patient with eczema who is in despair because of the eczema. Now you see, it's completely different picture. Because if you ask yourself, what characteristics she should have after similimum 4 weeks from now, what you want to see 4 weeks from now, you want to see my eczema is gone, but maybe something else came up in between and I'm very worried about it. Please give me another medicine for this new complaint. Or you want to see a patient telling you, well, my eczema is 50% better. It doesn't itch so much. And I feel quite fine. It's okay. So you can see the patient is more balanced, right? And if the patient is more balanced mentally, emotionally, and it comes together with the amelioration of the main complaint, it's a much better reaction. So in most cases, you don't get full symptomatology by a patient. They will not tell you the whole story. You have to observe. And by observing a patient, you get the rest. You get the rest of symptomatology. By not observing, but only focusing on what they tell you, you always get a part of symptomatology, not the full symptomatology. And this false impression that you have the full symptomatology, but you don't, can lead you to false results or false, false decisions like, okay, this is the full symptomatology. There are some blisters between the fingers and it itches terribly. So there are any other symptoms because she said so. So let's try anagalis and we'll see what happens. This is not okay. So in this case, you see despair from itching. And if you have despair from itching, you only have few possibilities. You know which possibilities you have. If you see a patient with such a strong despair from itching, of course, you have anacardium, you have psorinum, and you have dolichos. You can have arsenicum too. It's also important. So arsenicum, anacardium, psorinum, and dolichos. And psorinum is the most important out of all these remedies. So psorinum will be the first remedy you will ask for. So you will ask about confirmatory symptoms for psorinum. You can ask about appetite, thermoregulation, and everything, or headaches, or everything, right? And if you don't succeed with confirmation of psorinum, you will ask about anacardium, you will ask about dolichos, you will ask about other remedies. And in this case, most probably, you will confirm one of those remedies. You cannot ignore the despair from the itching. And because anagalis does not have it, you cannot give it, because it's a part of the picture and it's a mental part. It's an important part, much more important than the physical one. Juan has a question. When despair is expressed like that, could you also consider Helleborus? Well, in Helleborus, you have a different type of despair than in psorinum. In psorinum, you usually have despair or depression together with itching or following the itching. In Helleborus, you usually see the neurological problems, not skin problems so much. So, and in the Helleborus, the despair is different because in the Helleborus, there is something which goes together with the despair, and this something is dullness. So when they reach a state of despair, when Helleborus reaches a state of despair, they feel a confusion. So they feel despair, but they are unable to express what's happening inside them. And this makes them even more despair, right? So what you see is that they look at you and they try to find best words to express what they feel. but it takes a long time. You can feel the strain, how difficult for them is to put that into the words. So you ask, what do you feel exactly? Describe me, what do you feel? And they will look like this. They will look, they will put the fingers on the forehead. They will rub the forehead, which is a kind of stimulation of the brain. They try to stimulate the brain by doing this. It's a very important gesture in Helleborus. You can see it in Alumina too, but in Helleborus it's a keynote. And you will see the strain, and you will see the fear inside in their eyes. You will see the despair in their eyes, but they are unable to give you a proper answer. A dullness is not the case with Psorainum. They are not dull. They are quick to react. They are not slow to react. And the slowness, it's a very important part of Helleborus' picture. Yes, like Alumina. Alumina Alumina has it also. This kind of slowness, but in Alumina you don't see such a strong despair. In Alumina you see slowness. In Psorainum you see despair. In Helleborus you see both together.